Henry in Atlanta, Georgia. You're on the air with Representative Pocan.
Hey, thank you. And I really enjoy your show, Tom. Thank you for what you do.
Thank you, Henry.
I take medication from that's provided by Gilead. Without insurance, this medication is over $3,000 a month. I have coverage, but it only covers half of it. And I had to stop taking my medication about 6 months ago because I couldn't afford it. And I'm a guy that makes $90,000 a year. I really wanted to be pissed off at my health care providers, but what are they to do with medication so high? And I wonder, why is Gilead charging so much? Why are these pharmaceutical companies charging so much? And it seems like they prevent any other company from making a generic brand that is much more affordable. And my real main concern is not only the cost of the medication, but I haven't heard anything coming out of the White House about what can be done about the cost of medication. And thanks for hearing my call.
Sure, Henry, absolutely. I'll give you two words: Al Capone. Unfortunately, the pharmaceutical industry has learned to organize crime at a level that they can rip off U.S. consumers, sometimes to the detriment of 20 times the cost of prescription drugs we'll pay for in this country versus other countries. And because of their huge political octopus tentacles that they have, very little gets done around this. There are 1,500 pharmaceutical lobbyists in Washington, D.C. That's equivalent to 3 for every member of the House and Senate. I don't know who my 3 are, but that's a pretty screwed up system if you think about it. That's one of the reasons that Gilead can get away with what they're doing and every other company in charging these unbelievably unconscionable prices for prescription drugs. Now, the good news, Henry, is there is a major bill, one of the first 10 bills we introduced in Congress that we're trying to get done. The president is in the White House, so they want to do this. The question, again, will be, I think we get to, what's Joe Manchin, whose daughter happens to run EpiPen, going to say about pharmaceutical prices? What's some of the other members of the Senate, and for that matter, the House, who have very close ties to those 1,500 lobbyists and those companies that might be housed in their districts? What are they going to say? But there is no question that in many ways the modern equivalent of organized crime, you see those actions in how pharmaceutical companies operate in this country. And the last thing, Tom, I want to say, and I'm going to try to repeat this every chance I get when people bring up prescription drugs, every single drug in the last decade that's been approved by the FDA has had the support of the National Institute of Health for research, and that is our tax dollars doing that. So every single drug approved in the last decade has had your and my help, and yet we don't see any of the benefits of it. We just get these bills, and they rip us off compared to other countries. There's really no excuse for it, and we have to be aggressive going about it. And I hope that the bills that we have in the House can move forward, because we passed them last session, and we're ready to, and Joe Biden is as well. But we've got some issues on special interests and those tight numbers in the House and Senate.